Welcome to Wally's nursing videos. Today, we're tackling Nclex prep using the memory palace technique. By visualizing key nursing topics in a familiar space like your bedroom, you can retain and recall critical information with ease. Plus, I'll include common medication types and names to give you a comprehensive review. Let's dive in. 1. Bed. Sleep disorders and rest concepts. The bed reminds us of sleep disorders like insomnia, sleep apnea, and narcolepsy. These are frequent Nclex topics. Insomnia. Teach sleep hygiene, limit caffeine, maintain a bedtime routine, and avoid screens before sleep. Common medications: zolpidem, Ambien, esopiclone, Lunesta, melatonin supplements. Sleep apnea. Recognize snoring, apneic episodes, and daytime fatigue. CPAP therapy is the most common intervention. Medication adjuncts: modafinil, Provigil, for daytime sleepiness. Narcolepsy. Encourage scheduled naps and prescribe stimulant medications. Common medications: methylphenidate, Ritalin, modafinil, Provigil. Visualize: a giant CPAP machine on the bed for sleep apnea, or a glowing clock ticking loudly for insomnia. 2. Pillow. Pain management. The pillow represents comfort and pain relief. Pain management is a cornerstone of nursing care. Assessment. Use PQRST. Provocation, quality, radiation severity, timing, or numeric pain scales. Pharmacological interventions. Monitor opioid side effects like respiratory depression, constipation, and sedation. Common medications: morphine, hydrocodone, acetaminophen, Norco. Oxycodone, Oxycontin. Non-opioids: acetaminophen, Tylenol, ibuprofen, Advil, ketorolac, Toradol. Non-pharmacological techniques: heat-cold therapy, repositioning, relaxation exercises. Visualize: a bottle of acetaminophen spilling onto the pillow, or the pillow doubling as a giant ice pack. 3. Blanket. Thermoregulation. The blanket represents body temperature management. Hypothermia. Signs include shivering, confusion, and bradycardia. Warm patients with blankets or warm IV fluids. Hyperthermia. Symptoms include flushed skin and tachycardia. Interventions include cooling blankets, antipyretics, and hydration. Common medications: acetaminophen, Tylenol, ibuprofen, Advil for fever reduction. Visualize: a blanket changing colors, blue for cold and red for overheating. 4. Nightstand. Pharmacology essentials. The nightstand is packed with essential medications you need to know for the Nclex. Antihypertensives. Common types: beta blockers, metoprolol, ACE inhibitors, lisinopril, calcium channel blockers, amlodipine. Key considerations: monitor for hypotension and bradycardia. Anticoagulants. Common medications: warfarin, Coumadin, enoxaparin, Lovenox, heparin. Monitor INR, therapeutic range 2-3, and avoid vitamin K-rich foods with warfarin. Antibiotics. Common medications: amoxicillin, ciprofloxacin, Cipro, vancomycin. Watch for allergic reactions and educate about completing the full course. Visualize: drawers overflowing with pill bottles labeled with their names and side effects. 5. Lamp. Neurological assessments. The lamp shines a light on neurological concepts like cranial nerve assessments and stroke care. Cranial nerves. Use Parala, pupils equal, round, reactive to light and accommodation, for cranial nerve 3. Stroke recognition. Think fast. Face drooping, arm weakness, speech difficulty, time to call 911. Seizures. Maintain safety, clear the area, and administer medications like lorazepam, Ativan, or diazepam, Valium, for acute episodes. Visualize: a flickering lamp representing neurons firing or its light shining into a patient's eyes for a Parala test. 6. Closet. Infection control. The closet is where we store infection control essentials. Contact precautions. Use gloves and gowns for infections like C. difficile and MRSA. Droplet precautions. Masks for conditions like influenza and meningitis. Airborne precautions. Use N95 respirators for tuberculosis and measles. Place the patient in a negative pressure room. Key medications, rifampin and isoniazid for tuberculosis. Visualize. Gowns, gloves, and masks neatly hung in the closet, labeled with different precaution types. 7. Mirror. Mental health nursing. The mirror reflects mental health nursing concepts like therapeutic communication and managing anxiety or depression. Therapeutic communication. Use active listening and open-ended questions. Avoid judgmental responses. Anxiety. Teach relaxation techniques and grounding exercises. Common medications, lorazepam, Ativan, buspirone, Buspar. Depression. Assess for suicide risk and intervene early. Common medications, sertraline, Zoloft, fluoxetine, Prozac. Visualize. A calm, reassuring nurse reflected in the mirror practicing therapeutic communication techniques. 8. Window. Respiratory system. The window represents oxygenation and ventilation. COPD. Teach pursed lip breathing and administer low-flow oxygen to prevent CO2 retention. Asthma. Rescue inhalers like albuterol, Ventolin, are for acute attacks, while corticosteroids like fluticasone, Flovent, are for maintenance. SpO2 levels. Normal is 95 to 100%, though lower is acceptable in chronic respiratory conditions. Visualize. Oxygen flowing through the window or a clogged filter symbolizing impaired gas exchange. 9. Alarm clock. Time-sensitive interventions. The alarm clock reminds us of time-critical medications. Insulin. Administer rapid-acting insulin like Lispro, Humalog, immediately before meals. Anticoagulants. Ensure consistent dosing schedules to maintain therapeutic levels. Pain medications. Reassess pain levels promptly and administer medications as prescribed. Visualize an alarm clock ringing loudly at precise intervals. 10. Carpet or rug. Mobility and fall risk. The carpet highlights fall prevention and safe mobility. Assess risk. Use the Morse fall scale. Prevention strategies. Provide non-slip footwear, keep the bed low, and remove hazards. Mobility aids. Teach patients proper use of walkers and canes. Visualize a cane embedded in the rug or a large fall risk sign. 11. Dresser, lab values. The dresser is where we organize lab values. Electrolytes, potassium, 3.5, 5.0, MEQ, sodium, 135, 145, MEQ, calcium, 8.5 to 10.5, Megials, DL renal labs, BUN, 7 to 20 cal molnom DL creatinine, 0.6, 1.2 mildol, DL, hematologic labs, hemoglobin, 12, 16 GR DL for females, 14 to 18 G DL for males, DAS BC, 4,500, 11,000 cells. L visualize, neon signs glowing from the drawers with lab value ranges. 12. Ceiling fan, cardiac system. The ceiling fan represents the heart's blood flow and cardiac function. Blood flow, right atrium, right ventricle, lungs, left atrium, left ventricle, body. Heart failure, left-sided failure causes pulmonary symptoms. Right-sided failure leads to peripheral edema. Medications, furosemide, Lasix for fluid overload, digoxin for heart rate control. Visualize, fan blades labeled with heart chambers spinning like circulating blood. 13. Trash can, elimination systems. The trash can reminds us of renal and gastrointestinal elimination. Urinary output. Normal is 30 ml/hour. Watch for oliguria or anuria. Bowel movements. Recognize diarrhea or constipation patterns and intervene appropriately. Medications. Polyethylene glycol, Miralax for constipation, loperamide, Imodium for diarrhea. Visualize urine and stool charts spilling out of the trash can. 14. Wall art or posters, health promotion. The wall art promotes patient education. Vaccines. Stay updated with flu and pneumococcal immunizations. Smoking cessation. Encourage nicotine replacement or counseling. Nutrition. Teach about low-sodium diets for hypertension and carb counting for diabetes. Visualize. Posters with vaccination schedules and healthy eating guides. 15. DOOR. Emergency priorities. ABCs. The door symbolizes the ABCs of emergency care. Airway. Always secure the airway first. Breathing. Assess oxygenation and administer oxygen as needed. Circulation. Monitor vital signs, pulse, and perfusion. Visualize a glowing ABC sign above the door. Conclusion. Thanks for joining me on this tour of our memory palace. By assigning Nclex topics to items in a familiar space, you can organize your study material and recall it with ease. Practice daily, and let me know in the comments which associations worked best for you. Don't forget to like, subscribe, and hit the bell for more nursing tips. Good luck on your Nclex journey.